Excessive weight can have an impact on your health in numerous ways, including fertility and reproductive health. Dr. Mishra, a bariatric surgeon with Baptist Health Bariatric Center, joins us this morning to explain more. Thank you so much for joining us today.
Thank you for having me.
This might be a loaded question right off the top, but just simplify. Why is that the case?
We actually look at insulin resistance as one of the main drivers of this, especially with people who have polycystic ovarian syndrome. We tend to see a lot of overlap in hormonal dysregulation. And that's where this whole process comes into play, is that we notice just a touch of weight loss gets you headed in the right direction.
Okay, well, explain how weight loss surgery has helped your patients.
Oh, absolutely. Actually, that's one of the best things we hear about, is that people undergo the weight loss process. We say surgery, sometimes medications, whichever one you try out. As soon as you start to lose weight, you see a lot of people, who have been having trouble for years, all of a sudden will achieve their goals. They will get pregnant. And it's a lot to do with hormonal dysregulation. As you start to lose that weight, your insulin resistance goes down, the levels of testosterone, especially in women, tends to go down, and all of a sudden fertility is a lot more achievable goal.
Is bariatric surgery safe for patients who have had infertility?
Absolutely. Actually, it's one of the safest, especially because, women of reproductive age are very healthy, they're young, and so these surgeries are one of the lowest complications to begin with, and in young healthy people it's even lower, so we tend to do very well with those.
Can this surgery increase the chances of conceiving?
So one of the warnings we give everybody who has this surgery is that we really tell you not to get pregnant in the first year, because a lot of people who actually never thought they could get pregnant, conceive within the first few months, even weeks of this surgery. So after looking over the data so many years, we had to start telling people, okay, just got to be careful, because we don't want you losing weight while you are pregnant, because that's obviously not the ideal situation.
What procedure would you recommend for these individuals?
So especially for the young healthy ones, we tend to lean towards the sleeve gastrectomy, because you don't have a lot of the long-term damages associated with weight, like diabetes, cholesterol, blood pressure. But we usually talk to you about what your needs are. So it's either the sleeve or the bypass is the way we discuss these.
Well, many people may think that the surgery is too expensive. Is it covered by insurance?
So to give you an idea, that the state of Arkansas has now started to recognize, obesity as a major issue, especially in the state of Arkansas. So now all the state employees are covered. Insurances pretty much have covered it for a long period of time now. So especially after the state approval came through, majority of the insurances now cover bariatric surgery.
Okay, if somebody wants more information about this, what should they do?
Easy enough. You just go to Baptist Health Bariatrics, or you give us a call at 202-4477, and my team kind of usually walks you through the process.
Okay, anything else you want to say about this topic?
Not really. I think it's pretty self-explanatory stuff. As you can imagine, there are a variety of issues out there with infertility, and this just happens to be a tiny part of it that we can help with.
Okay, thank you so much for joining us today.
Thank you.
Appreciate it.